pleasure to introduce you to the newest MBA program offering at the Katz Graduate School of Business at the University of Pittsburgh. The University of Pittsburgh's Katz University of Pittsburgh Medical Center Executive MBA in Healthcare, or as we now know it, is the MBA program. I'm excited to tell you about this because we think that this program is innovative because it recognizes core strengths across multiple units within the University of Pittsburgh. But what it also does is leverages an area in healthcare that we know is subject to a tremendous amount of change and continues to be subject to a tremendous amount of change. So what I'd like to do is talk to you a little bit about how we got there. First of all, over 225 years, the University of Pittsburgh has been a leader in education, not just in business education, but across all scopes of education. As a founding member of the AACSB, we have led the way in business education, and we're a leader in the health sciences in the schools of medicine, nursing, public health, and pharmacy. This led us down a path where we started to think about how we could further leverage some of those strengths. Our program, as it stands and as it stood at the time before we started the MBA program, offered a variety of different options for students: full-time, professional, executive, PhD programs, and MS programs. But what we began to recognize is we were seeing specifically our Executive MBA program, more and more healthcare professionals that were expressing an interest in coming into the program. Moreover, what we were seeing were physicians that were coming through the program. Many of these physicians were getting their interest piqued by a unique executive education opportunity that we were providing through a program called the Marshall Webster Fellows, in which physicians were going through a 12-week, one-night-a-week program for an executive education certificate. But we had one bit of an issue that as we began to talk to some of the physicians that were trying to come into the Executive MBA program, it was a 2-year process for them to arrange their schedule because of the schedule that was related specifically to the MBA Worldwide program. We knew that we had a willing partner with the University of Pittsburgh Medical Center. UPMC is known as leading the way across a number of different healthcare platforms. They operate more than 20 academic community specialty hospitals. They're named to the U.S. News Report Honor Roll. And the physicians that we're seeing expressing an interest in the MBA Worldwide program were some of these same individuals. And so our challenge was, could we create a program that leveraged the UPMC network, took advantage of the strength that we could offer in the Executive MBA program, and put together a schedule that worked for these healthcare professionals. And as we looked at these core strengths, we thought that there had to be something that was there for us to pull together, and I'm very pleased that we've been able to do that, and I'm even more pleased to be able to share some of the results that have actually exceeded all of our expectations today. What we built was this. We built a UPMC program, Katz UPMC MBA Healthcare program that is now 19 months in duration, 48 academic credits. Now, the core pieces that start to work well for us and with physicians was our Executive MBA program, the traditional program, was one in which students met every other Friday and Saturday, and then there were 4 one-week intensives. This was a very difficult schedule specifically for physicians to arrange around their schedules. So that was our first challenge. What would we be able to do that? And I'm very pleased that in working with the faculty, we were able to develop a program that meets once a month. The students meet every Friday and Saturday, once a month. They have another 1/3 of their content that we have put into an online synchronous and asynchronous format, and then incorporated through the entire 5 terms of the program, the 19-month program, is a practicum. And what we see this as is a value add for the hospitals that are allowing their physicians and their healthcare professionals to come into the program. So what we ask the students to do is to pick a project that they believe will add value to what they're doing in their day-to-day work. It's the core piece of experience-based learning that we do here at the Katz School. Once they do that, then they work with their employer to gather data to work, and the idea is that they take all the knowledge they've gained within the 19-month program and then capture that knowledge, apply it to a project, and then add value back into the healthcare setting in which they are now working. So it's a way for them and for us actually to demonstrate back to the healthcare professionals and the healthcare providers the way in which a true and fundamental business education can significantly add value to what they're doing day to day in ways that they likely have not even thought of in the past. More importantly is that we looked at a networking reach. So as I'll talk about at the end and sort of what our goals are long term, one of the things that we were actually thinking about was a way to get interaction in the classroom. And so I talk a lot about physicians. But interestingly enough, we also were looking for a range of healthcare specializations. And as you'll soon see, we're able to do that both across hospital settings, health insurance settings, sales, medical sales, medical device sales. And so we thought it was important to get these individuals in the same room, share experiences, and then allow the faculty that were in the room then to take outside experiences from other areas of industries far outside of healthcare that are analogous to problems that they were facing in the classroom, and use that as an incubator for thought that allowed students to begin to develop ideas and to solve problems in innovative ways in a highly competitive market. We have been able to identify some of our leading faculty at the Katz School, and we have supplemented the classroom work with both physicians and administrative leaders from the University of Pittsburgh Medical Center, and this also now will give access to another 30,000 Pitt business alumni in over 90 countries for all of these students. So beyond just being able to have them in the classroom learn the business acumen, what we're able to do then is expand their reach globally. At the end of the day, what are we looking to do for these students? Well, we really want them to begin to gain confidence to embrace the change and adapt new challenges in the healthcare industry. I've been privileged to be able to lead the effort for the recruiting and the development of this program, and in discussing with the applicants that were coming through the program, it was striking to have conversations related to their desire to increase efficiency, to increase overall patient care, how they respond to patients. They are intensely interested in improving quality of care and efficiency for patients and for hospitals and in other healthcare settings day to day, but they have not to date had the mechanisms or the educational opportunities to teach them that way. And we see this as a way for them to do that and be able to begin to develop those skills to think and act more strategically, leverage tools, and more importantly, to create value in a way that they hadn't thought of before. Again, recognizing that there is a hyper-competitive market in healthcare settings, and we believe that we've been able to identify those areas for them that they will be able then to create the value that will allow them to remain competitive long term. Now, the curriculum itself was one that has been adapted specifically for this program. You know, in many cases, in some of the other programs we looked at, there were some really great programs there. They weren't necessarily MBA programs. So what we were seeing in the market was there were some offshoots of programs that you could take a couple of other courses around healthcare management. We thought this had to be an immersive, integrated approach to how we deliver a graduate business education for healthcare professionals. And to that end, we have challenged our faculty, and they have clearly responded, with creating each of their courses with some healthcare focus. So regardless of any of the courses that a student might be taking within the curriculum, what they're going to know is that either through the textbook, through the cases, through the classroom discussion, the faculty are specifically taking healthcare examples and plugging those into their lectures and into the work that the students are doing. Then what they're doing is, along those lines of adapting it to a healthcare-centric environment, then, as I mentioned, what they're pulling in are analogous opportunities to explain to students how, although this specific problem may be found in a healthcare setting, there are other industries that have had similar problems but may have solved them in a different way. Again, as a way to spur the thought in students to have them think strategically, innovatively, and always in a manner of creating value. The results, quite frankly, exceeded our expectations, and I think what I'm truly proud of, beyond everything we've been able to do with this program, and to give you some idea, we were able to launch and announce this program in roughly September of 2016, and launched the first cohort in May of 2017. And so we had a fairly short timeline to build up the demand for the program, and we ended up in our May class of 24 students. And I'll allow you to look at the breadth and the diversity and the depth of the titles of those students, of the students that are in the class. And these students scope across private industry, from nonprofits to hospitals, and sitting, being in class and sitting and listening to some of the lectures and some of the discussions and talking to the students, the conversations have been dynamic. They are, the students are already, after one term, coming back and saying, I was in a meeting and there was a conversation that was happening with our accounting team, and I knew the right questions to ask, or with our IT team, and they were talking about this specific issue, and I knew from what I was listening to the right questions to ask, and actually may have surprised them a little bit with my depth of knowledge. So what we're doing is now is we are at the forefront of creating these individuals that are going to drive value in healthcare for the next generation. As I mentioned, our initial forecast for students was approximately 20. We believe we have a very unique value proposition for these students, but I will tell you it is not without challenges. Tuition funding is a challenge for some students. The way physicians are compensated is somewhat unique in the industry, and so while some of the providers have been gracious in offering tuition support for their students, others aren't, and some are paying out of pocket. What we have found with the students coming in that business concepts are, quite frankly, entirely new endeavors. Unlike some of our traditional MBA programs where students come in and they've worked in business, and so there's at least some common understanding. These students are coming in, quite frankly, de novo, if you will. This is completely as new, and that has been a topic of conversation on perhaps some boot camps coming forward for students to kind of get them up to speed, if you will. So when they hit the classroom in the first term, we can get them thinking and talking more in sort of the business, around business acumen, much more than the field with healthcare, what they're used to. These students are uber achievers, if you will. In spite of the significant amount of class time that they're putting in, and what we tell them is for every hour in the classroom, they can expect to spend at least 2 to 3 hours outside the classroom, plus their online work that they have to do. These students are continue to work full schedules, many hours, 60 to 80-hour weeks. And so they're very high achievers, in managing that time with them and walking them through that when they're under pressure has been a key challenge for members of my team. And for the faculty, they have spent a considerable amount of time adapting course content. The developing, both for the online and the course content, each of our faculty members are quite likely per course are putting in 70 to 90 hours worth of time just in order to properly build a course that we can deliver within this program. And so the amount of effort here has been tremendous, but it's an effort that we think is worthwhile. Finally, looking ahead. We truly believe we have created something that is unique. We think we created something that as word begins to get out among our students, as they start to go out into their national conferences, that we have the ability to grow this into a national program. The format allows for it. It would be easy for students to fly in once a month, stay in Pittsburgh, take their 2 days of courses, do the rest online, work in teams remotely. So we really think that that is a key fundamental piece for us. And to that end, what we're looking to do is create opportunities for the inaugural class to recruit for future students. We're continuing to look for ways that anecdotally we can capture value creation. So we taught the students about what they're doing. And then we also want to continually adapt our program and courses to new trends in medicine, as we think that is going to be the lifeblood of the program. To conclude, we are at the forefront of a program that is going to be unique in the industry. And it's going to be unique from what we can do because, and what makes this so innovative is that the relationship that we have developed with the University of Pittsburgh Medical Center is one that truly leverages the strengths of both organizations in a way that can have this overall national impact. And we're proud of the fact that our faculty have stepped up. The investment that we've put in for this in building the program, both for our online programming and for our adaptation for the curriculum, is one that we feel is well worth the cost. And quite frankly, by us exceeding our goals this year, and we expect to continue to do so for our next cohort, which begins next May, is that we also believe that this will have a positive budgetary impact on our school. Finally, what we think it's going to do, we'll continue to grow our footprint around what we're calling EDS and MEDS, education and medicine. We have created a program with pharmacy, a Master's of Pharmacy and Business Administration that's now getting ready to enter into its 3rd year. It's slowly growing. We've developed a joint MBA, MHA program with our School of Public Health. We're in conversations with nursing. We have a joint MBA, Master's in Social Work. And so what we're seeing is that we have now been able to take this idea of making healthcare a true core competency in business around our overall program. So thank you for allowing me to explain our program, why we have submitted this program for the Innovator Awards, and I hope you'll see why we're so excited about it. Have a great day. Thank you so much for taking the time to hear us.